Now back to our top story. Yesterday, the White House declared this week Black Maternal Health Week, drawing attention to the health disparities that Black mothers face when it comes to pregnancy and childbirth. 3 News Now reporter Jessica Edson spoke with those here in the local community who are working to close the gap when it comes to maternal health.
Every year I say on her birthday is just, it can be kind of a down moment for me, but at the same time, it makes me happy that, it's a blessing to still be here because it could have been something totally different.
Following a C-section, Latasha Willis had to be rushed to emergency surgery when she began losing too much blood. She woke up a day later, having missed her daughter's first day in the world. Stories like hers are common amongst Black women, who nationally are 2.1 times more likely than white women to suffer complications in childbirth. They are also 2 to 3 times more likely to die during delivery. Experts say this disparity is less about biology and more about society.
There's nothing inherently wrong with a Black woman's body. So we see the risk of death has nothing to do with race or the skin color, but everything to do with the lived experience of being Black in the United States.
Things like severe stress and inconsistent access to healthcare play a large role in these disparities. In Nebraska, only 60% of Black women will receive care in their first trimester. And when healthcare is available, implicit bias is still finding its way into the birthing room. Inaccurate stereotypes about Black women having a high pain tolerance are still widely believed in the medical field, leading many concerns going unheard. That's in part why the Omaha Black Doula Association was created.
We are in these rooms to advocate for them and to say, like, we're not being listened to. We just want to live and thrive as human beings like everybody else.
A bill has also been introduced in the Nebraska legislature that would require medical providers to be trained on implicit bias, the health risks that affect Black women, and make access to doulas more available. Willis says looking at the work being done for Black mothers, she is hopeful for the future.
I have a daughter now. She's 5 and she has a long ways to go, but just knowing when her time comes, she'll have those options, and she won't hopefully feel the way I felt or have the same experience that I had.
Reporting in Omaha, Jessica Edson, 3 News Now.
You can find links to more resources related to Black maternal health on 3newsnow.com.